So we discussed Hetu and the Linga, Aushadhi, then the next view of the Acharyas, and 19.7 we stopped. Yeah.
Yes.
Okay. So I told you that this is 19.7 is a very, very important topic. So let's keep it for the next time.
Okay.
Right? Yeah. Okay. Let's do this one. And it is one of the very important and interesting also, because in Ayurveda we understand that the disease start quite early in life, and we have enough time to take care of it. But modern science says that it will be the problem is like it starts with the symptoms, isn't it? That you have symptoms or you have problem. But in Ayurveda, we say that lot before the symptom starts, 3 stages before at least, your body start telling you that there is a problem. I will explain to you. Okay. So any question from the past class? Do you want to discuss anything? Or shall we just continue ahead?
Okay.
No? Okay. So we are doing 19.7, knowledge of applying different therapies and medicines in different kriyakala. Kriyakala, this is important because all medicines are not effective in every stage. Each stage of the disease has to be handled differently, right? Because acharyas say that if the problem is of like my hand is touching to something continuously because I'm working in a chemical factory or something and it keeps on touching me. So he says uh, the last stage maybe I need medicine, or maybe my skin is just finished, I need a graft. That is like a later stage. But he said initially first stage will be take care, do not keep on touching the thing which has problem. So he said each stage has a different approach. Sometimes you just need to avoid. Oh, I avoid, I will not do it again, sorry, I'm good, right? Sometimes even you avoid, it is not going to help, you need medication. Sometimes it is even the medication will not help. Now it is inside you, it is in you, and it is going to be a problem for your whole life. You have to be just careful and learn how to live with it, right? So it is this science is not like a fake science which will say cure everything. In Ayurveda we have 4 categories of the diseases, and which are sukha sadhya, means easy to cure, kashta sadhya, difficult to cure, yapya means whole your life you need to learn how to live with it, you can never cure it. And last one is going to take your prana, right? That it is going to kill you, do anything. So acharyas have said that the good doctor need to be very alert on these things. If the disease or the problem which is going to kill you for sure 100%, and you say I will treat you, I will treat you, it will give you a bad name. So he said for a doctor it is very important to understand which is curable and which is not curable, so that you do not earn a bad name, and you can tell the patient clearly that this is going to be a continuous whole life problem. It's up to you how you are going to handle it. You want some changes in your lifestyle so that it can be subdued. you do not want to change anything and continuously want to do one medicine or herbs, whatever you want to do, but it will go with your death only, right? It will stay with you. So they have very clearly mentioned these things, that do not try to be fool, and do not try to make others also fool. Try to understand. Okay. So this is that acharyas have said that there are there are stages in the problem, and in during those stages different approaches you have to follow, right? In initial stages it can be easy, later on stages difficult, and maybe in the last cannot help, maybe whole your life off and on you will be in this problem. Or maybe it is like last stage, nobody can do anything. So whatever time you have left with you, try to have a good quality life, right? Okay. So in that, acharyas have said, and let me just read it and then we will explain. Kriyakala, different stages of spreading disease in the body. Now, why it is important for us? Because we also can learn and be alert with the first stages, right? Alert, oh, uh, this is can be a problem if it continues. Maybe I will be in a problem, right? But in this category, these diseases will not come like agantuk disease, which are like a guest, like accidents and all. That will not come. In this category, uh, your genetical problems, hereditary problems, by birth problems, they also will not come, right? Old age, because you're just aging. It's like a hunger, like age. So no, these also will not come. Okay. So these are the six kriyakalas, understanding of spreading of the dosha in the body. It is of six types. So mostly this six type kriyakala, the disease is very important in understanding the the type of disease. So six type of kriyakalas. Number one is accumulation. Okay. Number two. So accumulation is sanchya, aggravation. This is, we call it in Sanskrit, aggravation, right? Number three is spread. Number four is localization. Right? And manifestation and differentiation. Number five is manifestation. And number six is differentiation. Let's first read and then I will explain. And this is very, very interesting and very important. Accumulation, initial stages where dosha imbalance start happening, some dosha start collecting wrongly, hence spoiling the equilibrium. Jaya is the name of the stage in Sanskrit. Here we can feel it like bloating, loss of appetite, heaviness, pale complexion, weakness all the time. So if we take care at this stage, this is the very early stage. You must have seen that whenever you had some chronic problem like thyroid, diabetes, hypertension, whenever these things will start, before that time, you will feel that you have gone through some stressful time, right? That it just spoiled your equilibrium, or you must have gone through some physical illness, long time physical illness. Means a little bit longer time, you will be always feeling weak, no energy, do not want to work for some of the days, and you feel like you are lost, you do not want to work. So bloating, constipation or diarrhea, this kind of symptoms also may happen. This is the stage when doshas are starting to collect. It may not show you. So this is the stage where modern science has no knowledge about, right? If you will see, I'm feeling weak. Okay, so take some energy capsule, vitamins, or any kind of supplements. Or if nothing happens, like you are taking all supplements, your vitamin levels are good. Okay, maybe you are under depression. Let's start some antidepressant medicine, right? Because that is how they understand these things. We understand it as a dosha accumulation, that doshas are somewhere collecting and creating problems. Maybe we cannot understand right now which disease it will become later, right? But yes, we can understand it is vata pitta kapha. Which one is this? Okay. Then is aggravation. This accumulation is first stage. Start collection slowly, slowly. Something is collecting. Next is aggravation. After collection, dosha starts showing their mild symptoms, which means that it may get bad if we do not take action at this stage too. This is the next stage. First stage, we ignored totally, right? Now, doshas will start slowly showing some signs that please take care, I'm not good, right? So ama is also made during this stage. Here, burning, thirst, belching, bad burps, abdominal gas will be there. So this is the next stage. Some of the sign and symptoms are like this, that this will be the ama stage. And in ama stage, you will feel water retention. You will wake up little swelled here and there. Your hands are tight, your feet are tight, your face is bloated. So these are the next level symptoms that will start showing. Ama stage, toxins. If not taken care by this time also, it will start showing little more bad signs. It is called prakopa in Ayurveda. Prakop, prakop means getting angry, right? It's a very simple Hindi word. You can even say like God's prakop, because some earthquake happened, tsunami happened. What was that? Oh, God's prakop means angry, getting angry, right? So here, sancha means collection. So you can say like, what are you doing? I'm just doing some sancha of some good knowledge. I'm doing some sancha of food particles in my fridge. So food items or, food packets, I'm sancha, doing sancha in my fridge. So sancha is a simple word, means collection. But here in Ayurveda, when we say sancha, sancha means the sancha collection of the dosha. Okay. And prakopa is that the doshas are started getting little angry. Okay. Starting to show more symptoms. And so bad doshas start moving in the body through circulation. So they are now, everything start, even in the mind or body, everything is going to affect the hormones, right? So you have lots of stress, lots of tension, lots of stress, everything else is good. Slowly it will start creating acid, indigestion, right? Not because that your system is bad, but because you have lots of stress. Maybe no stress, everything good, but maybe your digestion is weak, right? So it's not like one thing. It is always, body is like a one piece. One thing is not working. You must have seen when your one side body is weak. So you will see that your other part start developing in a very different way, right? It starts developing in a very different way because it has to adjust, make the adjustment for the other part, right? So body is not one thing that we will be just like, thinking that this is this, just the had, this is just the indigestion. No, 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 no. Everything is one. It's one piece. One thing is not good, slowly other thing will be affected. So aggravation, now the doshas will start moving in the body, creating more problem. Then is next is spread. In this stage, after affecting the dhatus, where it started collecting, showing bad effects, it starts spreading to other dhatus also. So spoiling their functions too. So during this stage, doshas will start collecting and showing bad effects and, spoiling the functions of other dhatus, right? Like blood, so your hemoglobin down. Bones, you have osteoporosis. In the hair or skin, so less hair, bad hair, or in the skin, like hives, hives or itching or any kind of eczemas. So this is the stage when the other dhatus are also showing effect. This is the stage of spread. In this stage, after affecting the dhatu where it started collecting, showing bad effect, it starts spreading to other dhatus and spoil their function. So it in Sanskrit it is called prasara. Prasara means like spreading, like the plants. Have you seen the plants? They go like this, right? They can spread anywhere. So this is the prasara stage. This is the spreading stage. So weakest point in the body where immunity is very less, start getting all toxins, symptoms like nausea, diarrhea, pain, loss of taste. So these things can happen during this stage. Whatever is weak in your body genetically, or by your body type, or by any reason, whatever is weak, now the toxins will go and attack that, right? Maybe you always have sinus issues. Maybe you always have a bad skin. Skin problems are so easy to come to you. So this is your weakness. So ama, toxins, very smart. They will not fight with the strong part of the body. They will see which is weak. Okay. So weak part will start showing flare up, right? If it is eczema, bad eczema. Okay. If it is like you have diabetes, so maybe diabetic foot or bad eyesight, So this kind of symptom, whatever is bad in your body by genetics or by some reason or by your functions, by your work, wherever you have a weakness in the body, it will be affected first. Even the accidents, like by chance you had an accident and this arm of yours was broken or something. So this is weak. This joint always hurt. So whenever you have problem, this joint will be swelled up first. Always, right? Little bit cold, this joint. Why this is painful? Only this joint is painful in the body. Oh, I had a fall. When I was small, I got hurt and there are some rods in it and I have problem. So these toxins, very, very smart. They will go and catch this part first. Whatever is weak. Can be sinus, can be tonsils, can be lungs, can be heart, can be your blood vessels, can be your skin, anything. Okay. Okay, so that is the spread stage. Then is localization. Localization means sthan sanshaya, we call it sthan sanshaya, means now the toxin got an address. First it was whole body. Now I have an address. Yeah, where are you? Oh, I stay here in the this is my home, right? So instead of running here and there, finding the place to live forever, so they find the space. Oh, I got a point. So sthan sanchaya means localization, that I become a local now. I got my address, I have a home here. So localization. Here it destroys the weakest dhatu first and deposit there. In Sanskrit, it is called sthana sanshriya. Sthana means place. Sanshriya means shifting or collecting there. So after finding the weakest point in the body, toxins start depositing there and spoiling the function of that part. Right? So wherever is the weak point, it will start collecting there, make it a home, and start living comfortably there. Next is number 5 is manifestation. Did I give you Japanese words for that? Manifestation is mipio, mipio, or mipio. You will call it
Mibio.
mibio. Okay. Okay. So that is manifestation, means just one step before the disease. Because of accumulated toxins, health starts spoiling, and in modern medicine too, this is the stage when they can understand the disease and start thinking what could be the problem. In Sanskrit, we call it vyakti. Vyakti means, oh, I'm there, open. Anybody can see me, anybody can know me, I'm here. I have a personality. Vyakti means a person. Vyakti means an identity. So here, now the disease has an identity, right? Like, oh, give me a name. I'm here. You can give me a name, right? So this is the stage when where modern medicine say, oh yes, there is a problem because my hand is swollen, is painful. Before that, since maybe 6 years, I was into the problem. Always weak, feeling weak, low energy levels, not taking care. My joints were painful, and I was like, okay, maybe I'm tired, this and that. I kept on visiting the doctors, and they start giving me calcium supplements, this, that, right? And I could not address the problem, right? So now my hand is always swollen, okay? So now I go to the doctor and my hand is swollen. I cannot lift my hand. Oh, yes, problem. I understand, right? So this is that identity. There is an identity anybody can see now. This is painful. This is, I cannot lift. You take the x-ray and you can see the problem, right? So this is the identity of the problem, and modern medicine can say, yes, you have a problem, okay? So this is the Vyakti stage of the problem. Now at this stage, we start getting the blood reports, other tests abnormal. Before that, it will be, might not be show in the blood tests. But now it will start showing that there is a problem. So this is the condition where in chemical medicine too, they call symptoms. So from here, we can easily know the disease as it is established now. So it is anybody can see that this is diabetes. The person is getting low or high sugar frequently. So this is the established problem now. With all the tests, blood tests, reports, you can find out the problem. Now, the next step will be differentiation. That many people come with the swelling in the hand. Is it arthritis? Is it old trauma? Is it just the muscular? Okay, that your muscles got hurt or something, or it is rheumatoid, right? Or osteoarthritis. So even with the swelling of the hand, there is a complete 7-8 diseases which have the same symptoms. So now last stage is we need to find out which one is this. Is this osteoarthritis, rheumatoid, or just an injury, or just an old injury, or you have infection, right? Joint infection, or you have severed your muscles or nerves, or accidentally you missed. This happened long back, but you could not understand that time. So we will be making a proper diagnosis. Okay, like from this we came to this, then we came to this, then we came to this, and now, right, this. Okay, so this is the differential diagnosis that we will give it a proper name. Pain in the hand, yeah, pain in the hand. So many conditions can give you pain in the hand, right? I understood. This is the fifth stage. I acknowledge that yes, you have a problem. Your hand is not good, but I still have to go to the next stage to give it a name so that I can start my treatment. Right? So that is the differentiation. Means now disease will show the type classification with the different names. You can make out and rule out various other problems with almost same problems, same symptoms. In Sanskrit, it is called abhivyakti or bhedavastha. Means just you can take out the one name. Means disease can be easily diagnosed and all symptoms can specify one problem. This is the time when we diagnose in modern medicine also, and we can start the treatment. But in Ayurveda, much before we can understand which dosha is getting accumulated and which part of the normal body can be destroyed. In Ayurveda, what is the benefit? That we can be alert much before, because we understand that this is a Vata person, this is a Kapha person, this is a Pitta person, okay? Because you are a Pitta person, so probably you may get some later on, you may get some acid problems, high blood pressure issues, anger issues, violence, inflammations in the body, urinary tract infections. So we can actually little bit can tell you. And if by chance you have some body part weak, which you always keep on getting, anytime I am sick, my throat becomes like, right? Oh, okay. So you have a weak throat. Anytime, any problem, I get diarrhea. Oh, so like that, we can understand that this part of the body is weak, and which dosha is governing this part, right? So like that, much before we can get alert, right? We can get alert and we can find a solution. Okay, so that was the kriyakaal. Very beautiful and very interesting part. Okay, any question? No? Okay. Let's just stop the meeting and connect in at 11 after 7 minutes. It's 10:53. So 11 o'clock, same passcode we will be using. I always use same meeting ID and same passcode. Okay. Okay. So we will start in 7 minutes again. Let me just say this. Catch you.